Hi, everybody, and welcome. Thank you for joining us today for something that I am quite excited to be a part of. This is the launch event for the Global Alliance on War, Conflict, and Health. If you don't know me, my name is Arwa Damon. I am a former CNN senior international correspondent and the president and co-founder of the charity INARA. And these issues of war, conflict, and health are something that I know intimately and that I feel very strongly, sorry about that I feel very strongly is something that we really need to look at new, different, and innovative ways to come together to begin to combat. I have been reporting and working in war zones for nearly 20 years, which, yes, sort of gives away how old I am right now, but that's okay. I lived in Baghdad for CNN for almost a decade. I've reported extensively from countries as they went through the Arab Spring. I spent years going in and out of Syria, covering revolutions, ISIS, civil wars, and I've witnessed the impact of roadside bombs and bullets and suicide truck bombs and rockets and mortars and how they rip and shred through a human body and scorch it and leave those who manage to survive as, scarred shells of their former selves. I've seen how these events just shred a person's reality, tear families apart. But at the same time, what I've also witnessed is the beauty and love and possibility that emerges when medical support is provided, when medical interventions actually take place. And it was my experiences in war zones that ultimately led me to create my own charity, INARA. And at INARA, we provide medical and mental health treatment to children who have been unable to reach it. So we basically, in a nutshell, we take on the cases that other organizations don't. And through that, I've been able to see how we can alter an injured war story. We can alter a war injured child story so that it's no longer defined by cruelty and violence, but rather more by kindness and compassion. And I've seen how a child whose eyes look deadened come to life once they're able to see a life that is no longer defined by their injury or their scars, once they're able to see a life where they're not confined to the fringes of society or imprisoned and ostracized because of their injury. One of the cases we had at INARA, her name is Tahani, and she's about 9-10 years old. And she has these horrific burns on her face and her hands. In fact, her hands are really just little nubs that she has. And she loves drawing. And so she'll use these hands of hers and she'll grip this pencil in between her with what's left of like her fingers. And she draws the most exquisite things. And she's chatty and she's funny and strong and talented. And I naturally assumed that she wanted to be an artist in the future, but she quickly corrected me. She said, no, my dream is to be a doctor. Now, she was only able to have that dream because she knows that she's getting treated for her injuries. And that's not even to say that she has or that she ever will fully overcome her injuries. They are a part of her story. But what she has overcome is the trajectory that her life was on prior to a medical intervention. And now she's on a path where her injuries are no longer the dominant factor. She can see a life beyond them, a life that she gets to decide. The sad reality is that the status quo of current interventions is not good enough. Not when we look around the world today and all of the need that exists across just about every single continent. And we need to look at new ways to provide care and treatments. We need to look at new ways to reach populations in need. We need to be creative. We need to figure out new and different ways that we can come together across a variety of industries. And we need to take action, not just talk about the actions that we want to take. It's up to us. That choice is ours as organizations and as individuals. And with that being said, it gives me great pleasure to introduce Professor Jabbour, who will be speaking on behalf of the chairs of the Alliance, the Lancet-AUB Commission on Syria, and the Faculty of Health Sciences at the American University of Beirut. Welcome, Professor.
Hello, everyone. Thank you very much, Arwa, for hosting and moderating this event. Thank you, esteemed panelists, for your joining this launch. And thank you, colleagues from all over the world, for being part of it as well. Dear Excellencies, colleagues, and friends, first, I want to apologize for some of the technical difficulties that we are encountering. Some of our colleagues are not being able to join us, so they're actually there might be a bit of shift in the sequence of attendees of speakers, so we can accommodate this. Coming together to launch the Alliance is a profoundly meaningful moment, and I will use my time to acknowledge and thank the people who have made this moment possible. Richard Horton, the Lancet's editor, created the space for the Lancet-AUB Commission on Syria and challenged us during its inquiry. Unknowingly, he planted the first seeds that eventually grew to become the Alliance. He has done this with other groups, and I suspect this is why he is called a global health hero by many. During his tenure as Dean of our Faculty of Health Sciences at AUB, Emmanuel had believed in the idea, extended early and consistent support, and nurtured the thinking along this path. The faculty and its current Dean, Abla Sbai, have continued this support. The research done by our young colleagues who were part of the initiative in 2018, Fatima Ghaddar, Nasser Fardousi, Ammar Sabuni, and Ghida Krisht, has really laid the foundation for a lot of the work that will follow. Our colleagues in the founding steering group and secretariat who came together in 2019 and served until the end of 2021 devoted time, ideas, and resources to the Alliance. Part of this group was the executive committee, which was instrumental in actualizing the Alliance. And they are continuing the work in the new executive board in this transitional phase that we are starting. Let me list them because I do want to acknowledge their contributions. Amy Hagopian from the University of Washington, who now serves as chair representing the People's Health Movement. Carl Blanchette from the Geneva Center of Humanitarian Studies. Marian Birch from the journal Medicine, Conflict and Survival. She's an editor there. And of course, Marianne Abu Zaid from Deakin University in Australia. We owe Marianne special gratitude. She contributed from the inception and served with unmatched dedication, passion, and skill until last December as the founding executive director. We wouldn't be where we are today without her contributions. Absence of dedicated funding to the Alliance has not deterred us from realizing our joint commitment to the cause of global action on war, conflict, and health. Today's event is a proof that the coming together of committed individuals from supportive institutions can make a real difference no matter the resources. Deakin University's support for Marianne's contribution was crucial to the progress made. Other institutions represented in the founding steering group also contributed. The Geneva Center of Humanitarian Studies, thanks to Carl Blanchette, King's College London Conflict and Health Research Group, thanks to Richard Sullivan, and Queen Mary University of London, thanks to David McCoy, who was there before he moved to the UN University in Malaysia. Several agencies provided research funding to the Lancet-AUB Commission on Syria, which helped support some of the work for the Alliance. Canada's IDRC, UK's DFID, which is now FCDO, the Asfari Foundation, which is also in the UK, and most recently, the Peace and the Human Rights Division of the Swiss Department of Federal Affairs. Their support has been crucial. This collaborative model will also take us forward during a transition period until the Alliance is fully established and registered and operationalized. The University of Southampton, the People's Health Movement, and AUB are pooling resources to co-host the Secretariat. Thank you, Amy Hagopian, James Batchelor, and members of the Interim Executive Board for your dedication and commitment to steering the Alliance forward during this phase. Last but not least, our fierce executive directors, Becky Brown, Elsara Badri, and Jack Denny. They bring a sense of mission and determination to the Alliance. We wish you well and look forward to working with you. The people I mentioned and the many not mentioned make me think of Margaret Mead's words. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Thank you, and we look forward to this journey together.
Thank you so much. And as you can see, this organization, this nascent alliance, has been bringing together quite a few people from quite different arenas across the world, which is a phenomenal first start. And so to start us off, let's have an initial discussion about why there is an urgent need to scale up global action on war, conflict, and health. And to that effect, I would like to invite our panelists to join me. Hopefully we won't be experiencing more technical difficulties, although what is a Zoom event without technical difficulties these days? Anyways, we have Professor Fadlo Khuri, the president of the American University of Beirut, Dr. Ahmed Al-Mandhari, the regional director for the WHO Regional Office for the Eastern Mediterranean, and Dr. Pierre Somse, the Minister of Health from the Central African Republic. And Professor Khuri, I send it over to you to start us off.
Thank you, Arwa. Thank you, Samir. Excellencies, colleagues, and friends, I think this is a pleasure and a very meaningful privilege for us to be together. I speak not just as the president of the American University of Beirut, but as someone who for many years was a practicing physician. As a physician concerned with the well-being of people, I see on a daily basis how wars and conflicts are at the root of so much ill health and public health dysfunction. Many of us have heard the call of duty and volunteered during conflicts from youth until today. Certainly that's the spirit that imbues the American University of Beirut. But I also see the relevance from my position as president of a university that lives in a country and a region with seemingly nonstop economic instability and conflict and commonly recurrent wars, many of which I believe you've covered recently. AUB's been around for 156 years. In the last few decades alone, we've lived through the brutal Lebanese civil war, recurrent Israeli invasions, and most recently, the consequences of both the brutal conflict in Syria and the economic meltdown in Lebanon with attendant social instability. So these wars and conflicts and their impacts on forced displacement have had a profound impact on our university and on our work. Recognizing this impact has led AUB to launch multiple initiatives that address health and war, conflict and displacement. The Faculty of Health Sciences Lancet-AUB Commission on Syria and Certificate on Public Health in Conflict and Protracted Crisis is one. The Global Health Institute's Conflict Medicine Program and Refugee Health Program, the Humanitarian Engineering Initiative, which is a collaboration between the schools of engineering and public health, bringing people together every winter, and the AUB for Refugees initiative. One of the things that we've had to do is we've uploaded more than 11,000 medical records for Syrian refugees onto the cloud in collaboration with EPIC. So taking serious action towards the human right to health in the setting of armed conflict has really been too long in coming, and we would argue that this is a fundamental human right and the responsibility of all. You could argue that some of the first breakthroughs on a human rights level came in the 2013 report by the Special Rapporteur on the Right to Health, Anand Grover, who recognized that insecurity often limited the abilities of states to ensure those resources necessary to maintain access to health, and maintained, and I'm quoting them, concrete steps towards the full realization of the right to health for all without discrimination and regardless of the status of persons as combatants or civilians is required. We're very, very far from that in a world where in the 20th century alone, more than 231 million people, more than half of whom were civilians, lost their lives in conflict. So we find that that scarcity of attention, or that short attention span, which we're seeing again now being reawakened with the Ukraine war, and an absence of long-term soul searching to find an answer is becoming part of the problem. And the right to health in situations of political and armed conflict has been serially ignored. That's why we're heartened by this commission today, by this initiative. So the basic premise underlying these initiatives for a university as a stakeholder is that we have an important role to play in responding to the challenges of war and conflict, whether through education, research, or indeed practice. This is a role that's even more significant considering what we've learned from the foundational research by many of our alliance colleagues, which show that institutions in countries and regions affected by conflict are failing to lead the response despite living the greatest burden of conflict. So we need to crawl out of our ivory towers and not just educate, but serve, treat, and change. And we have to change because the agency of local researchers and practitioners and advocates does have a profound potential to strengthen the response. One example is that universities, high quality universities, not only, if they put their mind to it, not only raise the GDP of countries if they're established, but they also narrow the disparities that have heightened greatly during the 21st century. So what's the importance of the alliance that we see from our perspective as a university? There are three dimensions. I think I discussed the first dimension, which is the emphasis on voice and leadership from countries and regions affected by war and conflict, and academic institutions stepping up. The second dimension is scope. I'm glad to see the ambitious objectives of the alliance going beyond the response to the immediate challenges of war and conflicts to focus on greater contributions in conflict prevention and transitioning out of conflict. The reality for any of us who live in the Middle East is we're in this for the long run. One war is extinguished, another seems to catch fire. So the alliance's emphasis on prevention and promotion needs to speak to each and every health professional globally. And there's a lot for us to do that we can see realized through the alliance's pillars and flagship. The third dimension is partnership. I note with some pride that the AUB partnered with the Lancet and hosted the critical meetings in June 2018 that started the process leading to today. AUB has only been able to achieve what it has in conflict by partnering with others. First, through our partnership with institutions in the founding phase of this alliance, particularly Deakin University in Australia, and now the University of Southampton, the People's Health Movement, in co-hosting the alliance's secretariat. This is the way of the future. None of us can seek to corner the mission or the credit. We have to work together. So from my perspective, I'm looking forward to hearing what we will arrive at today and moving forward at the American University of Beirut as an institution that has lived through wars, that's been profoundly affected by wars and conflicts, has played a significant role in moving out of the immediate conflict resolution. We recognize our responsibilities, and I assure you that the American University of Beirut will always be committed to this just and critical cause, and to the causes of peace, justice, and health for all. Thank you.
Thank you, Professor Khuri. And let's hope that we do actually heed your words and crawl out of our ivory towers, all of us, because the time for rhetoric passed a long, long time ago. Dr. Pierre Somse, thank you so much for joining us from the Central African Republic. The esteemed Minister of Health, yours is a country that knows conflict as well. And so we look forward to hearing what you have to add to this conversation.
Thank you very much. Dear colleagues, friends, and distinguished participants, it is a great pleasure and great honor for me to attend this historic event for the launch of the Global Alliance on War, Conflict, and Health. Please allow me to start by addressing heartfelt thanks to the organizers of this event for inviting me to participate in this launch, along which with other dignitaries, scholars, and advocates for health. I'm Dr. Pierre Somse, Minister of Health and Population of the Central African Republic. I'm also a public health professional with 38 years of practice. I was appointed as Minister of Health and Population of my country 5 years ago. Prior to that, I worked mostly as public health civil servant in my country and at international levels, including 17 years in the UN with UNAIDS. In addition to my country, my professional experience in war and conflict setting includes 6 years in the Democratic Republic of Congo and short-term consultancies in South Sudan. Dear colleagues and friends, war is a public health emergency. The thousands of people who are killed, physically wounded, or mentally affected by conflict every year should remind us that war is a tragedy with dramatic negative consequences on health. Most of those killed by war are in fact civilians. This is true globally, and in my country, this is unacceptable. As the Minister of Health of a country affected by ongoing conflict and atrocities committed by rebel groups, I witness every day the serious human and health consequences of war. I see it in the cries of those who have been injured or mutilated during harm's attack. I see it in the grief of victims of rape. I see it in the mental health consequences for thousands of women and men raped, as well as children who are orphaned by war or traumatized by the ongoing conflict and consequences. All these physical and mental health consequences create serious disease burden that require urgent attention by the health system of the Central African Republic. Yet, because of the conflict, the health system of my country is confronted with a serious challenge due, among others, to the destruction of health facilities by armed groups and attacks on health personnel and humanitarian workers. Following the 2013 conflict, an estimated 30% of health facilities were destroyed. Health workers had to flee conflict from zones because armed groups targeted them as agents of the state. The situation led to the collapse of health structures in some part of the country, making the population even more vulnerable to preventable and curable diseases. This resulted in several disease outbreaks, including vaccine-derived poliovirus, hepatitis, measles. The number of gender-based violence incidents due to conflict skyrocketed from nearly 8,000 in 2016 to 68,463 in 2022. During the first 5 months of 2020 only, an estimated 69 incidents of attacks on health and humanitarian workers were reported. The conflict have caused inequalities and inequities in distribution of health services, as shown in the distribution of health manpower by region. The capital city of Syria, Bangui, has the largest number of qualified health professionals, with nearly 21 health workers for 10,000 people, whereas the 2 health regions most exposed to armed conflict have each nearly 1 health worker for 10,000 people. The conflict has depleted those regions over human resources. Clearly, several decades of insecurity and political instability have had a devastating impact on the health status of the people of the Central African Republic. As a result, the country has the 2nd highest maternal mortality rate in the world, with 829 deaths per 100,000 live births in 2018. The impact of complete healthcare on healthcare system made it also difficult to prepare for and to withstand the shock of pandemics such as COVID-19. But these challenges do not mean that we are powerless. Our resilience to COVID-19 and our determined effort to increase coverage, to reduce malaria mortality, to expand access to HIV services in the last 5 years are testimonies to our commitment to advancing despite the challenge of conflict. Since 2018, we have seen critical progress. Immunization administrative coverage has increased from 54% in 2017 to 80% in 2020, and Syria has achieved the status of country free of poliovirus. The proportion of HIV patients or antiretroviral treatment has increased from 25% in 2017 to nearly 60% in 2022. In April 2019, the President of the Central African Republic, His Excellency Faustin Archange Touadéra, launched 10 presidential priorities for accelerated action toward universal health coverage. These presidential priorities include key health areas such as maternal health, girls' education, vaccination, HIV, TB, and malaria. These priorities strategically locate individual health and the strengthening of health system into a broader framework of peace and stability through the human capital development. We have also transformed the health crisis to opportunities for peace building. For the government of the Syria, effective health system that serves all population is fundamental to creating and maintaining peace. This has been my mantra as Minister of Health. On my own initiative, taking a personal risk, I have successfully engaged different armed groups by reaching out to them and advocating with them the fact that health facilities, health workers, and humanitarian actors should not be targeted. I have worked closely with humanitarian actors, including ICRC, Médecins Sans Frontières, the Center for Humanitarian Dialogue, and the United Nations to advance critical views, this critical view of health as a cradle of peace. As a result, health centers were able to care for both of civilian and belligerents. Leaders of armed groups would call me from the bush to make sure that their wounded soldiers who are captured are properly taken care of. In many instances, I broker the relationship between government forces and the humanitarian actors. Some of my experience are very well captured and described by Professor Leonard Rubenstein in his 2021 book entitled Perilous Medicine, the struggle to protect healthcare professionals from the violence of war. I have learned that healthcare system, mainly the hospital, are the mirror of the community and the society, particularly in a context of war and conflict. Careful observation of interaction between users and health professionals can help prevent a major conflict in the community or in the country. It is my view that dealing with the violence should become a discipline, an institutionalized function of the healthcare management to establish a systemic and predictable approach to problem of violence in healthcare and in the society. The Minister of Health should endeavor to make the healthcare space a safe haven for all. In this perspective, I have been guided by 4 principles that are anticipation, preparation, cooperation, response, and evaluation. To illustrate this, I would like to borrow from Leonard's books 2 stories about me, but it is well said by him. Story 1, good. Early on his tenure, a seemingly small incident at the hospital in Bambari convinced Dr. Somse of the need to act. A Muslim woman fell down a well and suffered an open fracture in her foot. By the time she was rescued 4 hours later, he had developed sepsis. Despite surgery, she died in the hospital. Her family accused a Christian nurse of poisoning the woman. A community health director informed Dr. Somse about the incident, but treated it as a minor concern. But Dr. Somse realized that the nurse was vulnerable to retaliatory ethnic violence. He asked his government to open an investigation into the death, which revealed that the woman had not been poisoned. The family accepted his conclusion. His commitment to speedy intervention in order to diffuse the potential for violence helped shape his response to an even more frightening incident in Bangui. On May 2018, members of an ex-Silika group attacked the Notre Dame de Fatima Catholic Church in Bangui, where thousands of people were attending a service, killing at least 16 worshippers. An angry crowd, including Christian youth with machetes, headed to the hospital to retaliate, killing a Muslim man who was accompanying a patient along the way. After learning the incident, Minister Somse realized that Muslim patients in the hospital were at grave risk of a massacre. Knowing the context, she is, quote, I knew that I had to go there very quick. He said, the country could have exploded, placing himself in the midst of an angry and unpredictable crowd, put his own life at risk, but he didn't hesitate. I told them to close the entrance to the hospital and hide the Muslim as young people with machetes were preparing to attack. He also worked with the Red Cross and MINUSCA to evacuate the wounded to another hospital. End of quote. It is because of my experience and personal engagement on the serious consequences of war on health and on the potential of health to reinforce equality and justice that I believe in the critical importance of this global alliance on war, conflict, and health. By bringing together health leaders, practitioners, academics, civil society, and other stakeholders, this alliance will first give a face to the issue and push it up into the global agenda. We must remind the international community that war is a public health emergency. I would like to also stress that this alliance is a call for solidarity and joint action. It is about bringing together the expertise of different stakeholders from the South and the North to work together, to share experience and advocate for resources to strengthen the health system of countries affected by war. We must work together to rebuild and develop the resilience of health system in countries affected by conflict. This is critical for peace, and it is critical for global health and the safety of our world. As the COVID pandemic has shown, in our interconnected global village, we are strong as our weakest link. So no country should be left behind to confront alone the challenge of war, conflict, and health. In that perspective, I applaud and approve the mission, the vision, the aims, and the activities of the Global Alliance as highlighted in the founding document. This makes the Global Alliance a catalyst for international partnership and global solidarity, for peace, for health, and for health for peace. What is unique and resonates strongly with me is the fact that global alliances will bridge the gap between the North and the South, with greater involvement and empowerment of affected countries, such as mine, in this global movement. Also critical to the success of global alliance, critical to the success of global alliance is the fact that it will be its ability to engage policymakers, especially ministries of health. Indeed, based on my experience, ministers of health have a central role to play as honest brokers for the cause of peace and health. The adoption of health and peace as a major theme of the 75th World Health Assembly is an opportunity and anchor for the Global Alliance on War, Conflicts, and Health. Let's take advantage of this political commitment at the highest level to position the alliance as a global key player in the issue of war, conflict, and health. I'm looking forward to becoming an active member of the alliance. I wish to congratulate the founders of the alliance for their audacity and their forward-looking and transformative leadership. Best wishes of a successful journey to the Global Alliance on War, Conflict, and Health. Thank you for your kind attention.
And thank you so much for sharing your thoughts, your story, and what your country has been going through. And can I just add that it is extraordinarily important that we continue to try to look at all sorts of different ways to bridge the gap between the global north and the global south. And while we're on the subject of needing to talk about the need to scale up global action on war, conflict, and health, I do firmly believe that no one on this panel and no one in this audience is satisfied, content with the state that the world is in right now. Fixing that is our responsibility. Wars are extraordinarily widespread, significantly devastating. The impact of them does not remain contained or confined to the regions in which they are taking place. And if we are going to try to globally recapture, regain control over our own humanity, we need to start taking action. There is, as I said before, no more time for rhetoric. And with that, I would like to turn to a lineup of individuals who will be presenting the Global Alliance to us, explaining more in depth how the Alliance intends to differentiate itself from other initiatives and take action on a number of these points. And so with that, I am thrilled to welcome Professor Amy Hagopian, who will be speaking on behalf of the chairs of the Alliance, the People's Health Movement, and the University of Washington, joined by Mrs. Al-Sara Badri, Dr. Rebecca Brown, and Dr. Jack Denny. I turn it over to the four of you.
Hello, everybody. Thank you so much for being here today. I am sorry for the frustrations of people trying to get into the room. I am certain that when we die and go to heaven, there will be no passwords and no borders. So welcome to the Global Alliance on War, Conflict, and Health, and its inauguration into the public health world. I so look forward to working with you all as we tackle this wicked problem threatening the health of all who have lived through war, who have suffered its direct and indirect and multi-generational effects, and who have been told there's not enough to take care of their needs because we're spending our treasury on armed conflict. In this essay for the journal Medicine, Conflict, and Survival, which is an organizational member of our alliance, we discuss the struggle to get war recognized as a problem where public health approaches could be helpful. You can look that up. The origins of the alliance go back to June of 2018, when colleagues from the American University of Beirut, including Professor Samar Jabbour, had the idea to invite fellow conspiracists to Lebanon to discuss the way forward for those of us interested in the intersection of war, conflict, and health. They were part of a group called the Lancet-AUB Commission on Syria. 24 of us came together to think up whether we needed some organizational architecture to provide us intellectual space and some stomping grounds. We decided to expand beyond academic boundaries from the very beginning. Before the pandemic hit, we had a second meeting in London in 2019. Here's a photo of that meeting. At our meeting there, we hammered a scope of work and some skeletal structures to move us to where we are now. The idea was to develop a platform that is big enough to accommodate various actors from multiple sectors and from policy, practice, and scholarship across different fields. Other important organizations adjacent to the Alliance have paved the way and provided ancestry for us. The International Physicians for the Prevention of Nuclear War and its many affiliated state and national organizations was founded in early 1980s. Interestingly, one of its founding members was also, like Dr. Jabbour, a cardiologist. People with big hearts are required for this work. Dr. Lown said at the time, physicians charged with the responsibility for the lives of their patients and the health of the community must begin to explore a new province of preventive medicine, the prevention of nuclear war. The American Public Health Association has also had a small cabal of anti-war agitators among its 25,000 members. And some of these, like Dr. Vic Seidel and Dr. Barry Levy, who I believe is in the room today, and Dr. Bob Gould, who may also be here, founded the Peace Caucus of APHA. So APHA is an important grandparent to our new alliance as well. Still, we believe there is room, indeed a need, for an independent organizational home for those of us in the health professions, including public health, who see war and armed conflict as among the most urgent threats to the public's health, and seek to find each other in this new alliance. So far, 122 member organizations and institutions have joined our movement. With this launch, we will now open to individual members as well. We are especially enthusiastic about welcoming students and early career professionals who seek to make this problem a part of their life's work. Many of us are public health academics, but this launch is much bigger than the academy. The public health profession has witnessed glimmers of bravery among us in taking on big tobacco, the auto industry, asbestos purveyors, polluters, and other corporate industrial giants who grow fat and rich in disregard of the public's health. Similarly, we hope to learn from those models to find ways to challenge the war industry and the oligarchs who profit from sending our young men and women to battle each other to keep the world profitable for big oil, Boeing, and Raytheon. Those battles produce not just death and dismemberment, but also massive displacement of people. UNHCR tells us we are now experiencing 100 million displaced people for the first time in the world's long and bloody history of war, slavery, and poorly managed disasters. We need the alliance to respond to global political failures to prevent conflict, lessen its harm to civilians and communities, and to protect health. Dr. Al-Mandhari, who was supposed to speak before me and maybe will eventually join us here today, will allude to the failure to prevent or reduce attacks on healthcare. Many have devoted their lives to the humanitarian work of picking up the pieces. They set up refugee camps, dig the latrines, and tend to the misery of disease such as cholera that is spread in such places. But it's time now to go beyond cleanup. The promise of public health is in the prevention, so some have tired of merely cleaning up after these man-made disasters and are ready to think up some strategies for prevention. The Alliance hopes to lead some strategic thinking on what methods might best be employed to get at primary prevention. The objectives are to support affected communities and advance the field. Our mission is to strengthen action on war and conflict as threats to health, and to uphold justice and accountability as the foundations for peace and health. We bring together researchers, academics, practitioners, and advocates who work to prevent war and promote sustainable peace. We mitigate the effects of war and conflict on health, and we support health during and after conflict. We've also given some thought to our theory of change. We believe that by building this alliance through collective action and the field that it will develop, we can generate the research, scholarly advocacy, solidarity, visibility, and voice to create legitimacy for work to challenge the assumption that armed conflict is a reasonable policy choice. We can dismantle the drivers of war the way we've worked to prevent other threats to public health. In our analysis, though, we've been quite clear that war can't be eliminated merely by refraining from military clashes. Peace is the product of a just world. No justice, no peace. We have done some foundational work to map the dimensions of this field. I'd like to make a special shout out and statement of appreciation to Marianne Abuzaid, our first executive director, who led the mapping of existing organizations, did a thorough literature review, examined the frameworks in the field, and examined the barriers to a genuinely robust engagement on this issue in the Global South. We must acknowledge here the inherently political nature of work to end war. This photo is of colleagues at the University of Washington early in the US invasion of Iraq. We can't be afraid to speak out early and often to end illegal and unjust wars. A peaceful world is possible, and we're so glad all of you are here to help us in the struggle to make it so. Okay, that is my remarks, and I can't tell where I'm sitting, who has joined us. So are we able to turn to our...
I believe that we are next going to Mrs. Al-Sara Badri, who will be joined by other executive directors of the Alliance, but she will be the one who is talking, and hopefully we'll be able to get this going. In the meantime, until I see her pop up on my screen, I just want to add to this conversation. Oh, and there we go. I don't need to add anything to this conversation. Hi, I will just toss it directly over to you.
Hello, I'm very, very excited to be here. And with me, we are three executive directors in the Secretariat, and I will let them say what they would like to say at the moment before I go into how we are going to be doing our work in the next few months. Over to you guys.
Thanks, Al-Sara. So I'm Rebecca Brown. I'm from the University of Southampton in the UK. And as Al-Sara said, I am one of the co-executive directors for the Alliance.
Hi, everybody. I'm Dr. Jack Denny. I'm very pleased to be here today. I'm also one of the co-executive directors of the Alliance and also from the University of Southampton.
Great. So my name is Al-Sara Badri. I have recently joined the Alliance, but I'm extremely excited to be joining this kind of work. It's really a passion of mine. I come from Sudan, and as you all know, it's a country that has been affected by wars for many years and still is. So in the next few minutes, I will just talk to you a bit or tell you about how we plan to do our work and what the Alliance is about and what objectives we'll be highlighting. I'm going to read from a prepared script because you never know how I can just like go on a tangent. So please, I may be a little bit focusing here and there. So as the executive directors of the Alliance and as members of the Secretariat, we are here to provide support to the Alliance as we work together on this very important aspect of health in conflicts and in wars. The Alliance aims to strengthen global action on war, conflict, and health through two sets of objectives. The first one is through supporting affected people and communities, and the second one is through advancing the field. How are we going to do this? So we encourage you all, first of all, to have a look at the founding documents if you haven't already. I'm sure you will find something there that talks to you, if not many things. So the Alliance will achieve its objectives through the following core pillars. We have a few core pillars, and I'm sure that when you have a look at the founding documents, you will be able to look at them in depth. But here I'm just going to go briefly over them. So the first one is promoting the evidence base for action and advancing science. We have the biannual conference, the observatory, the global status report, and outputs of thematic groups that will contribute to this. The second pillar that we have is providing global leadership through promoting strong collective voice, setting direction, advancing and inspiring vision. Everything we do and everything that we are going to do in the Alliance and the visibility of the Alliance and your use of its platform, of course, will contribute to this pillar. Connected to leadership is the engagement in high-level diplomacy and pushing for strong action on war, conflict, and health across all fields, from the global to the local as possible through the Alliance membership. Promoting cooperation, ensuring all have a valued voice. And this, of course, essentially is about working together as equals on a common agenda. We would also like to do conducting capacity development activities favoring scholars and practitioners in affected countries and regions, but also facilitating capacity exchange. And this is something that we really like to stress on, it's capacity exchange, because we all have something to share in this field. And this is why you have chosen to be here today in this launch of the Alliance. And we also would like to promote knowledge through that and exchange and translation of policy and practice. Underpinning all of these pillars of work that we are committed to is commitment, value, and strengthening the voice of people and communities affected by war and conflict, including communities of scholars and practitioners, and a commitment to continually learn. And this is, again, we would like to stress that it's all about knowledge sharing, and it's about exchange of experience and ideas to actually help us to achieve our objectives in this endeavor. So as the Secretariat in this transitional year, we would like to expand the membership of the institutions and extend membership to individuals. We will work over the next 12 months to define the governance and strategy to engage with members, to devise, to work on how we are going to do this. You see, even with the script, I can still stumble sometimes. And then we would like to also establish and staff various committees and task forces to build on the business of the Alliance and to see how we are best to complete the business of the Alliance. We would like to establish thematic working groups to drive the work, and we would like to hold topic-specific workshops to engage with you, our members, and the wider stakeholders. The Alliance has made an important commitment to several flagship outputs, such as a global conference, the Global Observatory, a global status report, and a global mapping report. Some work on these outputs has taken place during the founding phase, and we look forward to working with you to bring some of these to light. The Alliance agenda is ambitious, but we are confident that together we will make progress. So we will be contacting you soon to get your input and suggestions on this. But please, if you feel like contacting us before we reach out, please do so. We are really very excited to hear all about the things that you want to share with us. So in closing, I would like to stress again that the Alliance is a body driven by its members, their engagement, their dedication, and their conviction to leverage health as a means to end wars and to promote peace. This is something important that we really need to think about always. So as executive directors, on behalf of Becky and Jack, we promise you that we are going to do everything in our capacity to support the Alliance leadership and membership to realize the tremendous potential that we have here. Thank you.
Thank you so much for that, and wishing you all and all of us the best of luck. But again, it's not luck, it is going to be perseverance and that continuous sort of desire and drive so many of us have to try to push a boulder up a hill, even if it keeps crashing back into our face. But again, as I keep saying over and over again, you know, if we don't fight for our collective future, then ends up resulting is going to be all of our responsibilities. And I do apologize for my cats continuously bombing this seminar. So with this, actually, we are going to be going for a 5-minute break, but don't go anywhere unless you really need to go to the bathroom, because I do believe we have a video to show those of you who will be sticking around. Oh, I am so sorry. I have just been flagged that we do have one of our guest who was not able to join us earlier, who can join us right now. So hold on to your seats. Dr. Ahmed Al-Mandhari, the Regional Director for the WHO Regional Office for the Eastern Mediterranean, will be speaking to us next. And I turn this over to him now.
It is my great pleasure and honor to join you into this important, very important event. And thank you very much, Dr. Samir, for inviting me. I'm really very pleased to be with key leaders and, if I may call it, the wisdom of the world when it comes into this important topic. I'm pleased to join, for this important event, as I have said, and the Global Alliance on War, Conflict, and Health is even, needed very much now more than ever, given the global, context. Armed conflict is, in fact, impairing many millions of lives across the world. It is one of the most significant barriers to achieving health for all and the sustainable development goals that we have been really fighting and working very hard to reach before the due date. Conflict is a very critical problem in the WHO Eastern Mediterranean region, as you all know, and a major determinant of health in the region, as highlighted by the Regional Commission on Social Determinants of Health that have been led by Sir Michael Marmot 2 years back. 9 out of the 22 countries here in EMRO are experiencing graded emergency, and approximately 102 million people require humanitarian assistance. That is contributing to around 34% of the global humanitarian burden and around 15% of the region's total population, which are huge numbers, to be honest. The region continues to be the source of over 60% of the world's refugees, while 18.7 million of its people are internally displaced. And in fact, I have visited many of these camps, for internally displaced people, either in Somalia, in Sudan, in different countries, Yemen, and different places in the region here. Multiple disease outbreaks are occurring in the context of other complex humanitarian crises. Every crisis we face here in the region, from either drought, famine, and natural disasters, which is recently the earthquake that has hit part of Afghanistan, to outbreaks and pandemics, is made harder to respond by the conflicts that we are facing on the ground, which definitely disrupts access to vulnerable populations, disrupts supply chains, and threatens to reverse all the progress made in improving the health of millions across the region. Attacks, another major topic we are facing here in the region, in fact, is attacks on healthcare facilities and workers, which are an all too common features of modern conflict that we are facing here in the region. In 2021, talking about numbers alone, there were more than 800 such attacks in 15 emergency affected countries and fragile settings in the region, which leads to depriving many people, of urgently needed care, endangering as well healthcare providers and undermining health systems. These attacks resulted, in around 280 deaths and around 424 injuries among patients and healthcare workers. The latest was only a few days ago when a polio team was attacked in Pakistan, in which 2 police officers have been killed and 1 polio worker was also killed in the same event. Dear colleagues, war and conflict destroy health and social systems. And we have witnessed it here in many regions, in many countries here in the region. Their impact lasts for generations and after the conflict has ended. In addition to conflict-related traumas and injuries, the risk of illness and death from many other threats to health is increased, including infectious diseases, non-communicable diseases, gender-based violence, and human trafficking. Mental health and psychosocial health are also very negatively impacted. And we see deterioration of sexual and reproductive health, including maternal and child health. Disruption of health services has a disproportionate impact on vulnerable groups, such as women and children, internally displaced persons and refugees, elderly people, and persons with disabilities. Addressing conflict is not just a priority for conflict-affected countries, but for all countries in our region, as the health impact of war and conflict spread across national and regional borders, displacing large number of refugees, threatening global food security, and raising risks of radiological, biological, and chemical events and hazards. So there is an urgent need to stop wars and conflicts and scale up the collective response to them. WHO's constitution recognizes that health for all people is essential to achieve peace and security, and that peace and security are essential for health. We have been working to promote peace through initiatives that emerged in the 1980s as part of WHO's approach to the provision of the post-conflict health assistance. The Health as a Bridge for Peace program, which we established and created in WHO in 1997, and peace-building approaches have to come central within the United Nations system. As our Director General, Dr. Tedros, have mentioned it this year in one of the meetings, there can be no health without peace and no peace without health. As part of our work to realize our vision, regional vision, health for all, by all in the Eastern Mediterranean region, we hosted a number of high-level meetings and consultations in Cairo, which led to the development of a regional strategic framework on health and peace in 2019. Later that year, the WHO regional team launched the Health for Peace initiative, which we call it HOPE, which has recently expanded into the Global Health for Peace initiative to reinforce the role of health in the promotion of peace. And that initiative has been led by Oman, supported by Switzerland, as well as supported by many other countries around the globe. The key principles of the initiative are equity and inclusiveness, participation by communities and citizens, local ownership and leadership to sustain efforts over the long term, and finally, context specificity. No two conflicts are the same. Therefore, our action cannot be one size fits all. Our understanding of a conflict has to inform how we engage stakeholders, how we engage communities, and how we plan programs and interventions to not only address the priorities of communities and promote health and well-being, but also build social cohesion and trust and develop resilient communities. We are making good progress in strengthening and operationalization of the link between health, social cohesion, and peace building, focusing on the unique role that health sector can play in convening different stakeholders and promoting joint planning and action with health as a superordinate goal. This year's World Health Assembly endorsed a decision to support the Global Health for Peace initiative, acknowledging the important contribution of peace to health and well-being. The decision was put forward by the Minister of Health, as I have mentioned, of Oman and the government of Switzerland. Dear colleagues, the only way to tackle the massive health challenges that conflict and insecurity bring is to work together. And I am very pleased, very much pleased when Dr. Samer communicated to me, informing me that he and global leaders are having and hosting this important discussion. The Global Alliance on War, Conflict and Health is a welcome new platform for such work, bringing together a large and diverse membership. It is a global resource that can greatly benefit the Eastern Mediterranean region. WHO's regional team here has worked in recent years to sensitize stakeholders in this work, build capacities of frontline workers across the region, and raise awareness. The alliance, bringing together academia, practitioners, and advocates, is perfectly set up to play a crucial role in driving this work forward. Though steps have been taken, we need more evidence generation to guide our action, more capacity building, and more advocacy to mainstream the health for peace approach in the work of health sector. Building partnerships will be key for the success of this initiative. And WHO stands ready to support you in strengthening collaboration with other United Nations agencies and stakeholders across the humanitarian development peace nexus. In closing, I would like just to echo, in one of the remarks, Dr. Khuri, in thanking everyone who has worked so hard, to establish the alliance or organizing today's launch. And again, I'd like also to thank Dr. Samer Jabbour for this initiative, assuring you that we are fully committed here in IMRO. Myself personally, my colleagues in the regional office and country offices, the ministers of health as well in the region are very much committed to move forward together in establishing something that will definitely help us in saving lives and serving the vulnerables and leaving no one behind. So I would like us to say, let us join forces to build a healthier, fairer, and safer world for everyone. Thank you very much, and back to you, Arwa. Thank you very much.
Thank you so much for your words, and let's hope that they are in fact turned into action. And now we will indeed be taking a 5-minute break. So as I was saying, if you need to step away, go ahead. If not, we do hopefully have a short video to show you, and I will be back in 5 minutes with our next panel. Thank you all. There are images that are just completely seared into my mind, still photographs almost, mostly of children's faces and of the way that the trauma of everything that they've been through just plays out on them. Most of the time when you come across these children in the war zones, they've just fled the violence, they've just been pulled out from underneath the rubble, they're shocked, they're traumatized. Her name's Maryam, she's 10. And there with her older sister Inam. They say a mortar hit their house just as they were trying to make a run for it. One of the biggest challenges that we face when reporting on war zones or reporting on refugee crises is taking the intense emotions and experiences that people have gone through and somehow trying to condense that into a news report. And, for myself and for a lot of my colleagues, we're often left with this question of, did we do enough? The children on the refugee route, their parents have taken such risk to try to get them to what they believe is going to be this better life. They're exhausted. They've spent days and weeks on the road, sleeping out in the open, not knowing how they're going to be getting from one area to another. Hi, everybody. Welcome back. Sorry for that abrupt cut on the video, but I think it does give you a sense of, some of what we do witness when we are out there. And some of this is a reality that those of you who have joined us here today know only too well. And I think, something we're thinking about also is the risk and consequence of what happens when there isn't medical intervention. What happens when we do allow entire populations to fester, in the sidelines, in the shadows of societies where they're unable to grow and develop and actually become contributors to society. And as we heard from our panelists earlier, we are only collectively as strong as our weakest link. And right now, the sad reality of the world is that our weakest link is extraordinarily weak, and it quite simply does not need, nor should it be that way. And so to move us on to our next topic of discussion, which is exactly how the Alliance is going to be delivering on its promise, I want to start off that conversation with Mr. Ian Overton, who is the Executive Director for the Action on Armed Violence, a group that is doing some very important work. Ian, I hand it over to you.
Thank you very much, Shawa. And it seems that you and I actually have been on a similar journey. I've spent around 20 years as a conflict reporter for people like the BBC and Channel 4, and eventually ended up with around 26 conflicts having been witnessed as a correspondent and reporter. And now I run this charity called Action on Armed Violence. And I believe we have some potential for some slides, but Action on Nonviolence really has been exploring explosive violence for the last 10 years by analyzing English language media reporting. And what we do on a daily basis is we look at English language media and we seek out where there have been reports of things like bombs or airstrikes or suicide attacks, and we collate that data into a central repository. And over the last 10 years, what we found on a sustained basis is that when explosive weapons are used in towns and cities, either by state actors or by non-state actors, 90% of those killed or injured are civilians. And this is a sort of a permanent presence on the battlefield. And it's not just an instance of us finding this in Syria or finding this in Afghanistan or Ukraine. It's us finding this in 123 countries where explosive weapons were used between 2011 and 2020. And what we're seeing in Ukraine today is I guess a microcosm of the wider patterns of harm that we've seen across the world. Next slide, please. So our explosive violence monitor has captured over a decade, and this isn't even including the last 2 years, of in excess of 1/3 deaths and injuries just recorded by English language media in global reporting. This isn't French media, this isn't Spanish media or Arabic media. And so the essence of what we're saying is this is just the tip of an iceberg, but it's a tip of an iceberg where the patterns of harm are unequivocal. And as you can see, the upper arc of the graph is total casualties. The lower arc of the graph is civilian casualties. And so the difference being those are not our state actors who have been killed who are not civilian casualties who would make up the difference. But when you see a rise in total casualties, you invariably see a rise in civilian casualties. Indeed, 73% of all people killed or injured by explosive weaponry over the last decade have been civilians. Next slide, please. The type of weapons that we're seeing, around 50% of all civilians killed or injured are killed or injured by improvised explosive violence. Around 1/4 by ground launch weaponry systems. There's things like grads and mortars, and around further 1/4 by air launch weaponry systems, such as drone strikes and airstrikes. I think the next slide, if possible, please, Gary. Thank you. But irregardless of what weaponry systems have used, one thing that we found absolutely salient is that those weaponry systems are almost always used in towns and cities. And when they are used in towns and cities, civilian harm is absolutely excessive. So when explosive weapons are used in towns and cities over the last decade in over 123 countries, we have found that 91% of all those killed or injured were civilians. When they were used in lesser populated areas, such as wooded areas or hamlets, we would find that 25% of those harmed are civilians. So what we're really looking at is the 21st century as the century of urban warfare. And I think that that is absolutely central to the work that this alliance seeks to do, is to analyze and capture how modern day technology, modern day warfare will impact civilians in urban settings. Next slide, please. So how do we do this? Well, obviously, Action on Nonviolence's data is largely based on capturing the numbers of direct civilians' deaths from injuries, and from explosive weapons. But what we fail to capture in the English language media reporting is something that UNIDIR has come out and offered a solution to. So UNIDIR has created an indicator of harm list of the sort of things that explosive weaponry impacts should be contemplated when you look at the reverberating harm of such weapon use. Both the damage and destruction that it causes in initial phase, the changes in key services caused by such damage and destruction, and the changes in civilian well-being as a result of the changes in key services. So the three levels of harm caused by explosive violence breaks down into a whole myriad of types of systems and impact, such as impact on housing, on cultural property, on transport networks, on waste management, on water management, obviously on health facilities, health workers, and medical supplies, the impact on births, the impact on preventable diseases, and the impact on educational facilities and educators and school days lost. Now, these are just some of the reverberating effects that we're seeing currently in Ukraine, but we're also seeing in Afghanistan, we've seen in Syria, we've seen in Iraq, we've seen in Pakistan, and countless other countries that have been beset by explosive weaponry systems in the last 10 years or so. So the hope is, and if I think that's the end of the slides, I can come back to myself, please. The hope is that this observatory will offer up an opportunity for the Alliance to come together and to find new ways to capture not just the immediate harm caused by explosive violence in terms of its impact on civilians' lives lost or injured, but the longer term harm. The types of injuries sustained over time, the impact on the economy, the impact on the infrastructures of the cities that have been damaged, the impacts on healthcare. And without a more comprehensive, widespread analysis of this sort of data, then lessons will not be learned. But I am hugely excited by the opportunities offered by this alliance, because I think that communities can come together. Just as Arwa and I came from a journalistic community and entered into more trying to do NGO work, I think NGOs need to be speaking to academia, academia needs to be speaking more to the UN needs to be speaking more to journalists, etc., etc. And the capturing of data will be at the very heart of those conversations. And I believe that the observatory and the Alliance will provide invaluable information for us, not only to understand the past wars, but what future wars may bring. And in so doing, prepare civil society for the challenges ahead. But thank you very much for setting this up. I think this is a remarkable opportunity, a remarkable initiative, and one that shines a small light in an age that seems increasingly beset by darkness. Thank you.
Thank you so much for that. A lot of really important points highlighted. And I also recognize that sometimes, you know, the numbers and everything can seem overwhelming and just like numbers, but, you know, I think it's worth us all remembering that there's a human story behind every single one of those. There is a child who has lost a parent. There is a parent who has lost a child. And now I would like to turn it over to Professor David McCoy, who is the research lead for the International Institute for Global Health at the United Nations University. Over to you.
Thank you, Arwa. Can you hear me?
Yes, I can.
Great, good. Thank you. Thank you. Good morning, good afternoon, and good evening from Malaysia. It's really an honor to be asked to speak at the launch of this important alliance, just as it was an honor for me to have served as a member of the founding steering group. My background is in medicine and public health. My career has been a bit complicated, having worked both as a clinician and a public health practitioner. I've worked in academia, I've worked in civil society, I've worked in government, and currently I now work within the UN system. However, unlike many others speaking at this launch and perhaps people attending, I've never actually lived through a war myself. But Nonetheless, I've always seen the promotion of peace and justice as being a fundamental duty of a health professional. And I've tried to live up to this statement. I'm going to share my screen now. This statement that comes from the 1981 World Health Assembly. Most of my work experience in the field of war and conflict and health actually took place between 2013 and 2017, when I served as the executive chair and then the director of MedAct, a London-based health charity that was formed in 1992 following the merger of two pre-existing medical peace organizations. One was the Medical Association for the Prevention of War, which was founded in 1951 by a group of distinguished doctors who had at the time concerns about the Korean War and the impact of the arms trade on health. And then the second was the Medical Campaign Against Nuclear Weapons, which was formed in 1980. It was part of the International Physicians for the Prevention of Nuclear War, which Amy talked about earlier, having received the Nobel Peace Prize for, firstly, its scientific work in describing the risks and impacts of nuclear war, and secondly, for its important role in promoting informed public discussion about the causes and consequences of war. So those are two important contributions that health professionals have made in the past, producing new scientific work and promoting informed public discussion. One of the things that we did at MedAct was to organize 2 Health Through Peace conferences. One was in 2015 and the other was in 2017. And these were aimed explicitly at building the voice of health professionals in support of peace, or in demanding that where armed conflict was occurring, that warring parties adhered to international humanitarian law and found diplomatic ways to end violence. These conferences were also organized explicitly to build links between health organizations, including the British Medical Association, Médecins Sans Frontières, and medical journals like the Lancet, with those organizations that had a more direct and specific focus on war and conflict, including, for example, the Stockholm International Peace Research Institute, as well as the Campaign Against the Arms Trade. So in a similar way, I think the alliance that we're establishing today, that we're launching today, is designed to help advance dialogue across different disciplines and groups, and to build links between the practice of scientific inquiry and evidence generation on the one hand, with the multi-sectoral social and political work required to advance peace. Simply put, we must inject more humanity and moral courage into science and research, and we have to strengthen advocacy for peace and health with more and better evidence and data. A standing global conference on war, conflict, and health is one of the proposed signature initiatives of the Alliance, and I hope we can come together to make this happen next year. Now, although the Alliance is a multidisciplinary venture, I just want to say something specific about the particular role of the health community. I've already alluded to this when talking about MedAct, but health professionals really do have a central role. Obviously, we have a central role in treating and caring for the victims and casualties on the front line and their long-term effects afterwards. We have a role in acting as witnesses to the suffering and injustice that often accompany war and conflict, or rather always accompany war and conflict. This gives the health community a legitimacy in being able to promote peace, being able to protect peace. Being a science-based profession, we're also a trusted and credible source of information and truth about the causes of war and conflict, and we must use our voice to bring truth to the general public. Health professionals also have a track record of working cooperatively across national borders and across religious and ethnic divides. We've seen this in the instance of COVID, where health professionals from multiple countries were able to transcend international politics and cooperate effectively as we responded to the virus. So we can also act as examples for politicians. Finally, in many countries, and especially in the global north, Health professionals are a large and privileged group with considerable social and economic standing in society. And this should and must give us a degree of confidence, freedom, and relative safety to speak truth to power and to call out on those who seek to provoke war or who seek to profit from violence and conflict. So I'm really looking forward to helping the Alliance amplify these roles for health professionals right across the world. As someone working now in the UN system, I also want to echo the words of Dr. Al-Mandhari by highlighting the continued importance of the UN system, including the UN Charter, which speaks explicitly about the UN's role in preventing and removing threats to peace in conformity with the principles of justice and international law. And also, again, to make mention of WHO's Global Health for Peace initiative, which I think provides a clear invitation to the entire global health system to develop a peace, health, and sustainable development agenda that can at least match the global health system's focus on disease and sickness. This hopefully provides some fertile ground also for the Alliance to grow and to hopefully quickly bear fruit as well. So let me just end by saying again, what a great honor it is to be part of the launch of this important alliance. Thank you to everyone who's been working so hard to get this alliance off the ground. And I look forward to seeing what we can do together. Back to you, Arwa. Thank you very much.
Thank you. Thank you so much for your words and for that information. You know, something that I've been thinking about a lot lately is sort of these definitions that we have that can be desensitizing sometimes. For example, when we talk about refugees and having witnessed countless people cross the border, whether it's outside of Syria or fleeing Iraq or Libya or Egypt or Sudan or more recently Ukraine, there's that one moment when you set foot across a border where all of a sudden your identity changes, it shifts, it alters. You, to a certain degree, go from being everything you knew yourself to be to having to live under this label of refugee. And I say that to introduce our next speaker, Dr. Bayan Lewis, because she knows that experience well. She knows what it's like to have to flee your own country, step across that border, and all of a sudden be labeled with something else, and how to try to re-navigate your life and rebuild everything. So I'm absolutely thrilled to have you with us and have you talk about your journey and your organization, multi-aid programs.
Thank you, Arwa. Hello, everyone. It's my pleasure to be at this important event, to participate in this launch and also to tell you my story. Actually, it wasn't an easy journey, but I'm here today because of it. The title of my story is Hope, Persistence, and Insistence on Achieving the Goal. My name is Bayan Lewis. I'm a medical doctor from Homs in Syria. Being a healthcare provider was a childhood dream. I started medical school in 2011, coinciding with the suppression of the popular uprising in Syria and its eventual transformation to be a protracted war in Syria. Of course, I didn't live the thrill of university life, as you would all imagine it, but it was a 6-year journey filled of adventure, fear, tension, but also determination. In 2012, my internal displacement journey started as I left my hometown with my family for another city that was safer at that time in Syria. Studying meant traveling long distances to reach the campus. Also, that will be done under the flying bullets and the threat of bandits, kidnappings, and the checkpoints. But unfortunately, things didn't go well, and my family and I were subjected to a siege in the city that we were living there. All of this led to drop out of my studies, and I dropped out of my studies at the university, and finally my family made the decision to seek refuge in Lebanon. I refused to leave and decided to stay alone in Syria in the shadow of the war, clinging to my only weapon, my knowledge. My parents respected my decision despite its difficulty. I went back to medical school and spent 4 years as a lonely girl in a country devastated by conflict. I had to be a diligent student, independent, careful, and wise at every step. Unfortunately, the educational journey through this war was also affected, as I missed the practical aspect of learning because the hospitals were out of service and the professor tended to reduce the required curriculum, not to mention the successive loss of teachers and professors or the out of service laboratories. This aspect is crucial for everyone, not only for medical students, because it threatens the country health future, as the generation of war had less than optimal knowledge and training. I graduated after hard work, efforts, and determination. The moment I graduated strengthened my faith and proved that my decision to stay back and finish my education was the right one, despite the risk I took to my life. After that, I was offered a position as a resident doctor in one of Damascus hospitals in the rheumatology department, but my longing to my family compelled me to travel to Lebanon to visit them. They had told me that they were doing well, just as I told them I was doing well. But it seems both of us hid our realities to protect each other. I arrived in Lebanon to find my family living in a tent for 4 years. Witnessing this was a source of real trauma, but I was determined to not dwell on it, but rather to use it and act on it. After a year of exploration to understand and deal with the reality of refuge and asylum in Lebanon, I was able to move my family to an apartment. I worked as the health provider leader of a mobile clinic serving 3,000 refugees in the camps in the Bekaa Valley for a year. I also volunteered with many local and international NGOs in health awareness and medical campaigns. I moved between several NGOs and held different positions, which enriched my experiences and developed me professionally until I reached MAPS. MAPS, Multi-Aid Programs, is the organization where I work now. This is a humanitarian organization founded by a Syrian refugee doctor and run by Syrian refugee health providers and other Syrian professionals to serve the health and educational needs of Syrian refugees, particularly the youth. This work has been very meaningful for me. In my current leadership position at MAPS as a projects coordinator, I draw from my own personal experience as a displaced refugee young professional who has gone through very challenging circumstances, but who has pulled through to share my story with you today. Despite my preoccupation with humanitarian work, I didn't stop looking for opportunities to advance myself and continue my goal to serve better. I enrolled and obtained a master's degree in public health from the Faculty of Health Sciences at the American University of Beirut. Not only have I experienced conflict, but I have also studied conflict and became a specialist in the field by obtaining a certificate in public health in conflict that protected the crisis from the American University of Beirut too. This was a tough but very rich experience as I enrolled full-time, but was still working full-time 1.5 hours away. This unique learning experience helped me build a solid knowledge base, enhance my skills, and gave me scientific tools to better understand and deal with the health challenges among refugees in Lebanon. I participated in numerous research papers with various universities internationally. As a result, I'm now a co-founder of a research center at the NGO where I work. Hopefully, these skills will allow me to contribute to future health work in Syria once I'm able to return. My long journey was possible because of my determination, the support of my family, and because I found fellow Syrian health professionals committed to working together to help refugees and help ourselves. My journey would have been easier if there was more support in the international systems for people like me. My journey the situation in my country of Syria, and the situation of refugees in Lebanon, including the difficulties facing refugees, health professionals like me, is why I find the Global Alliance on War, Conflict, and Health important. We need such initiatives that come from the ground up, that considers the situation of people like me and gives them a voice and a platform to share experiences and work with others from around the world, particularly those from other countries and regions affected by conflict. I learned about conflict and health through living in the conflict, but I also saw how important it was to build my capacity to understand research, to understand and research and deal with the complex issues of conflict and health. Young professionals who were thrown into conflict, like me, need a welcoming space to learn, research, work, and collaborate on health issues in conflict. I hope this alliance can become such a space for all of us. And thanks for giving me this opportunity.
Thank you, Dr. Bayan, for sharing your extraordinary story. And I have to say that, you know, I've heard so many similar stories, and each time I hear them, I am just as awestruck by the individual who was sharing them as I was the first time. And I wanted to ask you a question, since you have lived conflict, you have had all of the experiences that you have had, and in the context of the Global Alliance, what sort of concrete things would you, in theory, want to see the Global Alliance actually do, you know, make real on the ground to help the sort of, you know, communities that you are a part of and that you live in?
From a practical experience, I would focus on the aim of this alliance to hear the voice and value the voice of these affected population. In addition to these standards, scientific standards that we deal with, because hearing those affected population will help us to contextualize our intervention and being able to determine exactly where are the gaps and give the need that they need. And at the same time, being careful and to build the capacity of qualified population from this affected population will be a good investment for the future of this crisis, and to support rebuilding the country and rebuilding all the systems related to this crisis.
So we're basically talking about a multi-tiered approach where, you know, on one level, you're building up the capacity of medical professionals, and we know of multiple conflicts around the world, or even of populations that are trying to demonstrate against oppression that are heavily reliant on what we now call, you know, the underground secret networks of doctors and clinicians that are trying to help out and prevent. And what I also know from my own experience with my charity, INARA, is that, you know, especially when it comes to pediatric cases, early intervention means that the impact of an injury can be either reversed or significantly reduced, which is greatly important. Again, thank you so much for your courage, for the work that you have been doing, and for your contributions to try to make the space that you exist in just that much better for those who are around it. And I hope that we can all take inspiration from your actions and go on to look at our own spaces and where we exist and try to see what we can actually do, not just talk about doing, in terms of trying to make it all better. So thank you.
Thank you.
And now I want to just share a few sort of comments and observations of my own before we do end up closing this out. I have to say, it's extraordinary to hear from so many people from so many different countries, from so many different backgrounds, you know, coming together and really wanting to try to make a difference so that those who are impacted by war do not suffer more than they actually need to. And this does seem like a monumental task, because more often than not, we do realize that wars are carried out, conducted by forces, by individuals, by governments, that many of us, we can end up feeling like we don't have control over the situation. The circumstances are out of our control. And while on the one hand, that's true, I refuse to live in a world where we cannot somehow look at a way to regain control of that, to regain control of our own collective narrative. Right now, as I look around the challenges that our world faces today, I am horrified, appalled, and ashamed by how history is going to write this era. But I also believe that we do have it within our power to make changes. And I draw inspiration from the words of everyone that we heard today, from this effort that is being put forward by the Global Alliance, by the launch of various initiatives, by the need to understand the various and complex dynamics of each conflict, and perhaps more importantly, by the need to bring different groups together in a stronger and better way, whether we're talking about academics, humanitarians, journalists, corporations. We each have an ability and a capacity to be able to make change. And there have been countless initiatives and countless seminars and countless conferences, and I've been a part of many of them. And let's face the harsh reality, and that is that most of them do not end up actually making a difference. And the Global Alliance is the newcomer into the stage, into these various spaces. And I think from all of those who we have heard from today who are involved in this effort, there is a level of determination to sort of break that pattern and actually take these pledges and promises and pillars and turn them into something. So I'm really looking forward to see where this all goes. And while I'm on the subject of trying to look for new and innovative ideas, I just want to flag to everyone, since I have your attention right now. So my charity, INARA, is actually undertaking what some people are calling a wild expedition in our own effort to raise awareness, not just about the work that we're doing to try to treat war injured children, whether it's medically or through mental health, but also on a broader scale to raise awareness about how conflict impacts everybody. Because I personally, and I know many of us here today, was deeply disturbed by the difference and discrepancy in the West's reaction to what was happening in Ukraine versus what happened in Afghanistan, Syria, Sudan, Iraq, Libya, or any other country. And so what INARA is going to be doing is taking 2 war-injured Syrian young adults accompanied by a Ukrainian and an Afghan young women to stand together on the top of Mount Kilimanjaro and say no to war. And also say, when we are impacted by war, that impact is universal. The response to it should be as well, but also to show the possibility of what can be accomplished when we choose to come together and stand behind those who have been impacted by war. And to close us out of this seminar, I would like to invite Professor James Batchelor, who will be speaking on behalf of the chairs of the Alliance, who's with the University of Southampton. And from me, since these will be my final words, I just want to say thank you to all of you for joining me today.
Arwa, can I ask you to stay where you are so I can see you?
Does that make it more comfortable to talk? Yeah, sure, no problem.
So you asked me yesterday to be a bit of a protagonist at the end and to say something, because I think you briefly touched on the point that there are endless meetings, endless seminars, endless papers written, endless reports, but they very slowly or very rarely change into real dramatic change. And I think this alliance brings an opportunity for us to try and, dare I say, we need to give ourselves a bit of a kick, all of us. I know there's a lot of people here that are attending, and I'm grateful for everyone participating, both the speakers and, there's no point in having speakers if no one's listening. So all the people listening as well. And thank you to you for guiding us through this conversation that we've had today and covering some of the technical challenges we've had. So from you, if I ask you a question, to put you on the spot, because you probably love being put on the spot. What do you think could be the biggest thing that we could all immediately do today, you know, straight after this meeting? What's the first thing that you think we as an alliance could do to kind of make things happen, in your view? Because I've got a view, but I'd like to hear your view.
Right off the bat, I would
Yeah.
say either start a project immediately to begin to empower local communities. And by that, let's forget the word of empower local communities and whatever. Let's get training programs into communities that have been affected by war. Let's get mental health programs stronger, more solid into communities that have been affected by war. I mean, look, you know, at INARA, like we have kids that have not had mental health support or in fact medical care for years since their injury took place. They are still dealing with traumas of years past. Their bedwetting is at, you know, they're unable to function in society. I actually recently met a young Afghan woman who's 19 years old, and she went through war back when she was 13, managed to flee, and still today, because she had not gotten the mental health support that she needed, would go into fits of depression so strong she would lose her ability to speak. We need to recognize that when we're talking about interventions, they need to not just be about giving somebody food and water and a blanket. We need to give them the ability to manage their own lives. So I would want to see something happening along those lines. I know that the traditional, you know, humanitarian support is absolutely needed. I'm not saying that one should come at the expense of the other, but we need to simultaneously begin really focusing and prioritizing medical and mental health interventions.
So I completely agree with you. I think the biggest thing an alliance needs is something to hang its hat on as a first stage. And I guess the ask that I would have of everybody is to continue this engagement straight away. Don't just leave this meeting. I think it's important to keep an eye on what we're doing, re-engage with us constantly, keep the dialogue open. Some of you have asked questions during the course of this, during the course of us being together, both in the question and answer bit and also in the general chat. And I think from our perspective, the key thing is to keep that engagement, keep that interaction, ask people not to just sort of, I know most people here are already very engaged in this, but we need to reach out to lots of different people and bring people together. And the point that you made, which is my experience, which is actually quite short in comparison to a lot of other people here and working in this space, is looking for the people you don't think you need to be looking for. We've talked about silos of people working in silos, and we need to bring those walls down. We need to encourage people to actually work close together. And in our own work, you know, just like you said, we've had humanitarians, engineers, journalists, and academics in rooms which otherwise never would have happened. And I think the Alliance has an opportunity through its membership to really diversify the people involved in these conversations. This is a complicated problem to solve, and it needs real action to bring those people together. So I think to sort of finish, I would say, both on behalf of myself, Amy and Samira and everybody else in the Secretariat, for those of you who've been participating with us today, to you, Arwen, for your support in helping us host this. Let us continue the conversation after we've all left today. Let's make sure we reconnect together, hopefully in person, the next time and continue this conversation. But in the meantime, let us all try and work together and make the Alliance the success I think all of us want it to be, and to take it forward to try and tackle some of these hugely challenging issues. So thank you again on behalf of everybody for your time, patience, and your attention this afternoon. And I want to again thank you for your time and your cat's interaction with us today in hosting us through the afternoon. So thank you everybody for your time, and we look forward to seeing you and hearing from you all very soon. Thank you.